Welcome back. Every night at 5:30, we're getting answers to your question. It's our goal here to go in depth about the impact of coronavirus.
And that includes the healthcare workers. And right now is a particularly challenging time to be a medical worker in our community. I've been speaking with some doctors who are on the front lines, and they display really a commitment to work that is greater than their fear of getting sick themselves. So here's a really large part of my conversations that I had recently with Dr. Ajay Ponugoti, who is a hospitalist at Franciscan Health. And how does this coming week and the next week look for you?
Well, from our internal surveys, we think that the surge will be coming soon in the next 1 or 2 weeks.
Talk a little bit about what your experience has been about the supply and the demand.
The biggest resource we have and the scantiest resource we have that we cannot do anything about is the healthcare workers. We cannot produce a doctor in a day, it takes years. And we cannot produce a healthcare worker, it takes years. Those challenges are the one which is putting administrators at a lot of unease.
How are you feeling personally?
So it's a challenge not only being on the front line as a physician, it's a challenge because of my father. I have 3 kids and I have a wife, so I don't know if I'm bringing anything to them. That is a challenge for me because I don't sleep anymore.
How are the patients doing?
Most of the physicians, most of the people outside the world should recognize when these patients come to the hospital, no one can talk to them physically, their family is not there. We have great stories. I have patients who come who have been doing great that I thought maybe this patient is not going to do well, and I have a few patients, unfortunately, who decline in front of my eyes in days, in hours. The good news is that if you're healthy and you don't have much of medical problems, or most of your medical problems are under good control, even if you have them, you have a very good chance of getting through this. But it is those unfortunate people, that is the people who end up going into the ICUs. It is those critical patients that we're having very difficult time to get out of the ventilator once they're on it. And that's why we want this surge to explode, because we want more people to have an opportunity of having that last vital part before we give up.
What seems to be the common denominator?
The only protection today you have is your own body and your own immune system. But if you ask me, as of today, I'm sure every physician says that no one knows what works. In my 15 years of practice, I have never seen or encountered anything where for few patients, it's been less than 14 days of life. Because once they hit that critical, and it is hard to see, I've never seen so many healthcare workers having tears. I've never seen my partners holding my hands and crying for themselves and for others.
It must be hard to watch people that are struggling to breathe and people that are dying without their loved ones nearby. That must be heartbreaking.
I have never seen a disease wherein a patient is not surrounded by their loved ones. This is the toughest job and toughest thing to see every single day. This is what even scares every healthcare worker, because they know it could be one of them who could be breathing for the last time without having their loved ones besides them.
You can just see his heart is so much in his job there. And as we wrapped, he really wanted to get some advice out to all of us. First of all, he said, make sure we're taking our temperature every day. Only go to the hospital if you really need to, and make sure you call first. He also said that he thought we should have an antenna about something. He said that he had cases that were presenting with GI issues like diarrhea and not the chest pain that we've been hearing about. He says this is something he's not seen covered in the media, and it's something he really wants us to be aware of and have an antenna for, that could, for the way our body develops, be the very first thing. He says make sure you're getting plenty of sleep. Make sure your body is ready if something comes to this, that you're ready for a fight. And also, if you do get sick, make sure that you're wearing a mask and isolate. He says people are highly contagious, and you owe it to this community to make sure you're protecting others, Scott.
Yeah, hearing your